Chinese state media has reported a rise in cases of the human metapneumovirus, HMPV, though officials in the United States have not confirmed reports of an outbreak or said there is cause for concern. Newsweek has reached out to the U.S. Department of Health and Human Services, HHS, for comment via email. Why it matters. There are several viruses spreading across the US right now, including the norovirus and respiratory illnesses like the flu, coronavirus, and RSV. Any viral outbreak poses a public health risk, particularly for children and older people who may be more vulnerable to contracting serious illnesses when affected. What to Know Reuters reported last week that there has been an increase in cases of HMPV in China, particularly among people who are younger than 14 years old and living in northern provinces. Symptoms of HMPV include a cough, fever, stuffy or runny nose, sore throat, wheezing, a shortness of breath, and rashes, according to the Cleveland Clinic. Anyone can fall ill after contracting the virus, but the risk of severe illness is higher for people who are younger than 5 or older than 65. The virus can also cause complications like bronchiolitis, bronchitis, pneumonia, asthma, or an ear infection, according to the Cleveland Clinic. It's fairly common in children, causing up to 12% of childhood respiratory illnesses. Cases are typically fairly mild. Cases are typically most common in the late winter and spring, according to the US. Centers for Disease Control and Prevention, CDC. How long does it take to recover from HMPV? More mild cases of HMPV typically only last a few days or a week, according to the Cleveland Clinic, but some cases may take longer to recover from. The CDC notes that the estimated incubation period is 3 to 6 days, and the length of illness depends on severity. The CDC offers several ways people can prevent the spread of the virus, including washing their hands with soap and water for at least 20 seconds, avoiding touching their face with unwashed hands, and avoiding contact with people who are sick. There is no vaccine for HMPV. How HMPV compares to COVID, bronchitis COVID-19 is typically defined by a dry cough, though symptoms can vary. While HMPV is more common in children, there's not an age that is particularly affected by COVID-19, though older populations are generally more at risk of serious illness. Bronchitis, which can be caused by HMPV, is the inflammation of the bronchial tube lining. Symptoms include thickened mucus, and this can be a short-term or chronic illness, according to the Mayo Clinic. HMPV symptoms. As China faces outbreak, Chinese state media has reported a rise in cases of the human metapneumovirus, HMPV, though officials in the United States have not confirmed reports of an outbreak or said there is cause for concern. Christopher Furlong Getty Images. Is China going into lockdown for HMPV? According to Reuters, China has increased monitoring of respiratory illnesses, but there haven't been reports of lockdowns like those implemented to prevent the spread of COVID-19 during the 2020 global pandemic. Read more norovirus outbreaks. Doctors warn common precaution won't prevent illness. Matt Gaetz mocked after House applauds fact he won't return to Congress. Luigi Mangione was optimistic. Writer who spoke with alleged killer says what people are saying. Dr. Atul Goel, official for India's Directorate General of Health Services, per Indian news outlet NDTV. There has been news doing the rounds about a metapneumovirus outbreak in China. Let me be very clear on that count. Metapneumovirus is like any other respiratory virus which causes common cold, and in the very old and the very young, it could cause flu-like symptoms. What happens next? The US is continuing to grapple with high levels of respiratory illnesses, which typically spread more in colder months. The CDC's respiratory illness forecast predicts that the COVID-19 season peak could occur later this season. Influenza typically peaks between December and February, while RSV's season peaks vary by region.